I'm Dr. David Samra, Director at Progressive Longevity. In this section of our Longevity Medicine Education series, we're talking about sleep, not as a lifestyle extra, but as a core pillar of long-term health. Sleep is often the first thing people compromise on when life gets busy, but biologically, it is one of the most powerful tools we have to protect metabolic health, brain function, cardiovascular risk, and physical resilience. At PSM and the Progressive Longevity Clinic, we don't see sleep as separate from everything else you're doing for your health. We see it as a part of the foundation that makes the rest of the plan work. Sleep is really a force multiplier for health span. It doesn't just affect how rested you feel the next day, it amplifies the impact of everything else you're doing for your health. And we see that when sleep improves, we get better insulin sensitivity, appetite regulation, improved blood pressure control, better mood and emotional regulation, faster recovery from training, and improved physical and cognitive performance. But if sleep is poor, all of these same systems really struggle, even if nutrition and exercise are otherwise well planned and designed. And that's why we often describe sleep as a force multiplier for health span. And sleep does integrate with every pillar. It's tightly integrated with every major health system, and we spend a third of our lives doing it, or we should. Poor sleep raises cortisol, it disrupts glucose control, and it increases hunger signals. It places strain on the cardiovascular system, impairs recovery and tissue repair, and it makes training adaptation that much harder. This is why we never assess sleep in isolation. We interpret it alongside body composition, fitness, metabolic markers, and cardiovascular risk, because all these systems talk to each other. One of the most important roles for sleep is our brain's housekeeping. In recent years, we've made scientific discoveries on sleep that have advanced our understanding enormously. During REM sleep, which is when we're dreaming, the brain's glymphatic system becomes highly active. Cerebrospinal fluid flows freely through the brain tissue in that state, and it removes metabolic waste products that accumulate during the day, including proteins that can cause neurodegenerative disease. We're now understanding that this is one of the reasons we dream and we enter the state of REM. This clearance is dramatically reduced when sleep is short, fragmented, or shallow. It's one of the reasons chronically poor sleep is linked to poor cognitive health. Look at this, we need to move away from the bravado of trying to be more productive by functioning on very little sleep to prioritize this very important mechanism of maintaining brain health. And we see a clear link between sleep duration, cardiovascular disease, and mortality. These large population studies have contributed to showing a clear relationship between sleep duration and long-term health outcomes. Both short sleep and long sleep are associated with a higher all-cause mortality and cardiovascular risk. The lowest risk sits within a relatively narrow window, about 7 to 8 hours per night for most adults. Now, we're all different, and this doesn't mean everyone needs the exact same amount of sleep, but it does mean that consistently sleeping too little or needing excessive sleep should prompt a closer look. Now, what happens while you sleep? Not all sleep is the same. Light sleep helps with transition and relaxation. Deep sleep supports growth, physical recovery, immune function and tissue repair, and it increases growth hormone. REM sleep is critical for memory consolidation, emotional processing, and mood regulation. As we mentioned, it clears toxins from the CNS through that glymphatic system. And each stage plays a distinct role. When sleep is disrupted, it's often the deeper and the REM stages that are sacrificed first, even if total time in bed looks reasonable. It's what our brain picks from the smorgasbord of these phases that matters. So time in bed doesn't always fix the problem. In a night, this is what normal sleep architecture looks like. The sleep cycles between the light, deep, and REM sleep. Earlier in the night, deep sleep dominates and the heart rate slows, and later in the night, REM sleep or dream sleep becomes more prominent and heart rate variability increases. Disruption from things like stress, alcohol, apnea, inconsistent sleep schedules tend to fragment the pattern and reduce the restorative value of sleep, even if the total hours appear adequate. So if you miss out on the earlier stages of sleep, with late nights you tend to lose deep sleep, and conversely, if you rise very early, you tend to miss out proportionately on more of the REM sleep that occurs in the later phases. Sleep affects performance far beyond how alert you feel. In athletes, studies of sleep extension have shown improved speed, accuracy, reaction time, and recovery. But the same biology applies to everyday life. Decision-making, coordination, emotional regulation, and injury risk are all affected by sleep. It's one of the few interventions that improves both physical and cognitive performance at the same time. And this is our step-by-step approach. At PSM, we try to take a structured approach to sleep. Firstly, we accept that nobody is perfect with sleep and we all lead busy lives, but we start by assessing risk and symptoms. We then personalise strategies around timing, environment, behaviour, physiology, and where needed, we refer for targeted assessment and treatment. Importantly, we track progress and we review because sleep quality and timing changes over time. There isn't a one-size-fits-all process. Now, sleep health screening, there are a number of validated scales, and we use some of these brief validated screening tools to help understand sleep quality, daytime sleepiness and dysfunction, and sleep apnea risk. So these tools don't diagnose conditions on their own, but they help flag those who need reassurance or those who need more support and certainly might benefit from further testing. Our goal is mainly identification early. We're not looking to put diagnostic labels on people. We need to understand whether they need assistance. There certainly are some clear red flags of when further assessment matters. These include loud snoring, particularly witnessed apneas where you stop breathing, excessive daytime sleepiness, insomnia lasting more than 3 months, high blood pressure that's resistant to treatment. All of these do warrant further assessment, particularly if there's mood disturbance as well. And then we follow along the path of appropriate referral and track back and cycle through to reassess. For chronic insomnia, the most effective long-term treatment is cognitive behavioural therapy for insomnia, or CBT-I. CBT-I works by reducing conditioned arousal, consolidating sleep drive, and retraining sleep behaviours. It's more effective in the long term than sedative medications for most people. And while medications may have a role in selected cases in the short term, it's rarely the foundation, and there are certainly issues with reducing sleep architecture and quality, as well as creating physical dependence. Testing is used selectively. What we like to look at is home sleep studies to help assess snoring, apnea, and resistant symptoms of tiredness. Wearables can provide useful trend data, but they don't replace clinical judgment. Onward referral to a sleep specialist is certainly helpful if people have a high burden of symptoms and poor sleep, and blood tests can give us some clues here too. So the aim is not to test everyone, it's to test when results will meaningfully guide care and change management. Most sleep improvement comes from the relatively simple targeted levers around sleep hygiene. So these include things like sleep-wake timing, getting regularity in the environment, the routine, the nutrition, managing evening light exposure, which is the strongest stimulus for wakefulness, and alcohol timing. Exercise scheduling is also clearly important. And we focus on small changes here that are sustainable. Again, we have to expect that there is not perfection. So the key takeaways here are that sleep is not a luxury. It's metabolically essential and it helps optimize both physical and mental function. Consistency matters much more than gadgets. Environment and behavior outweigh supplements, and for chronic insomnia and sleep apnea, early assessment can prevent years of downstream health impact. At PSM, sleep care is coordinated, integrating medical oversight, targeted intervention, and behavioural strategies. This presentation is provided for general educational purposes only. It is not intended to provide individual medical advice, does not replace consultation with your own doctor, and should not be used to make personal health decisions. Health screening and treatment decisions depend on individual medical history, symptoms and risk factors, and should always be discussed with a qualified health professional. No doctor-patient relationship is created by viewing this content. If you have ongoing sleep concerns or symptoms, please speak with your GP or treating specialist.